I would like to begin by thanking the media for joining us for this important virtual Joint Health System press conference today. Thank you also to our community members who are watching the live stream of today's event. My name is Katie Kirkpatrick, and I serve as the President and CEO of the Metro Atlanta Chamber. 6 major health systems from across Metro Atlanta are here today with physician and nurse leaders to bring you the latest on the current COVID-19 surge from the front lines of the pandemic, and to encourage the public to please take the prevention efforts seriously. These health systems have collaborated throughout the pandemic at many levels for more than 2 years to share best practices, as well as to support, educate, and inform all of us on the ongoing COVID-19 crisis. Just last August, these health systems held a first joint COVID press conference during the 4th wave to share the reality and stories from the front lines of their hospitals. Today, as we continue to navigate the now 5th wave of the pandemic here in Georgia, these healthcare heroes are here to provide updates, to ask once again for the public's active support, and to remind us all that we are still in a crisis and a global pandemic that is significantly impacting our communities and our health systems. The health systems joining me today issued a joint press statement on December 29th with detailed information and safety measures that will help us get through the current surge and the pandemic together. Everyone can play a role in enhancing the health and wellness of the people in our communities. Our health systems and healthcare heroes have been working tirelessly throughout this pandemic. To give you perspective on how this surge has impacted Georgians, I will share that according to the Georgia Department of Public Health, on January 7th of 2022, alone, 21,271 confirmed PCR cases were reported. By comparison, on January 8th of 2021, 10,165 confirmed PCR cases were reported. As the numbers clearly indicate, this wave has caused a dramatic increase in our single-day records from previous surges and has put incredible additional strain on our healthcare providers and systems, as well as on the people and the communities they serve each and every day. While many have been talking about the mild nature of the Omicron variant, the fact is that more people are getting sick, and this is a problem for healthcare workers at healthcare systems like those represented here today. I am proud to be joined today by these esteemed healthcare leaders from the front lines who will share their perspectives and data points, as well as specific calls to action for all of us. So joining me today are Dr. Danny Branstetter, Medical Director of Infectious Disease and Infection Prevention for Wellstar Health System, Dr. Andrea Andy Shane, Division Chief of Pediatric Infectious Diseases, Children's Healthcare of Atlanta, and Chief of Pediatric Infectious Diseases for Emory University. Sharon Pappas, PhD and RN, Chief Nurse Executive for Emory Healthcare. Dr. Jane Morgan, Executive Director, COVID-19 Task Force, Piedmont Healthcare. Dr. Robert Jansen, Chief Medical Officer and Chief of Staff for Grady Health System, and Dr. Supriya Manapalli, Medical Director for Infectious Disease, Northeast Georgia Health System. So each expert will speak for about 5 minutes to share their perspective on the current COVID surge, and at the completion of this program, we will have a brief Q&A. Please make sure that you enter your questions in the chat feature as we move through the program. I will begin by introducing Dr. Danny Branstetter, the Medical Director of Infectious Disease and Infection Prevention for Wellstar Health System. Dr. Branstetter, I will turn it over to you.